Those were the words that changed everything. For many people, numbers like this don't mean much at first, but in reality, a blood sugar level this high is a serious warning sign. It's your body telling you that something is wrong, and it needs attention now. This is exactly what happened to one patient during a routine doctor's visit. He felt mostly fine, just a little tired, maybe a bit more thirsty than usual. Nothing alarming. But when the test results came back, the doctor's expression said it all. A reading of 240 is not normal. It's considered dangerously high and could be a sign of uncontrolled blood sugar or even diabetes. The most shocking part? He had been ignoring the small signs for months. Occasional fatigue, frequent urination, and sudden cravings. He thought it was just part of getting older, but these were early warnings his body was giving him. Many people make the same mistake. They ignore the symptoms, delay checkups, and assume everything is fine until it becomes serious. High blood sugar doesn't just stay in your bloodstream. Over time, it starts damaging your body from the inside. It affects your heart, your kidneys, your eyes, and even your energy levels. And the longer it goes unchecked, the more dangerous it becomes. This is your wake-up call. In this video, we'll uncover the hidden dangers of ignoring high blood sugar, what those numbers really mean, and what simple steps you can take to bring your levels back under control. A blood sugar reading of 150 might not seem alarming to everyone, but what many people don't realize is this. The same number can have very different effects depending on your age. After 50, blood sugar becomes much more dangerous, even if the numbers look similar. So, what changes? As we age, the body becomes less efficient at managing glucose. Insulin, the hormone responsible for controlling blood sugar, doesn't work as effectively as it once did. This means that sugar stays in the bloodstream longer, increasing the risk of damage. At the same time, metabolism slows down. Your body doesn't burn energy as quickly, so excess sugar is more likely to build up instead of being used. This leads to more frequent and longer-lasting spikes in blood sugar levels. Another key factor is muscle loss. After 50, people naturally begin to lose muscle mass unless they actively maintain it. Muscle helps absorb glucose from the bloodstream, so less muscle means less control over blood sugar. Even normal meals can cause higher spikes than before. The real concern is how this affects your long-term health. The same blood sugar level that might be manageable in your 30s can be far more harmful in your 50s or 60s. Over time, high blood sugar can damage blood vessels, increase the risk of heart disease, and affect vital organs like the kidneys and eyes. What makes it even more dangerous is that the symptoms are often subtle. You may feel slightly tired or thirsty, but nothing severe enough to raise alarm. Meanwhile, damage is slowly happening inside the body. This is why doctors emphasize stricter control of blood sugar as you age. It's not just about the number, it's about how your body responds to it. The good news is that with the right lifestyle choices, you can reduce these risks. Staying active, eating balanced meals, and monitoring your blood sugar regularly can make a big difference. In conclusion, after 50, blood sugar isn't just a number. It's a serious health signal. Understanding this difference can help you take action early and protect your health for the future. Blood sugar numbers can seem confusing, especially if you're seeing them for the first time. But understanding what these numbers mean is one of the most important steps in protecting your health. Let's break it down in a simple way. Blood sugar, also known as glucose, is the amount of sugar present in your blood. Your body uses this sugar as energy. However, too much or too little can cause problems. When you check your blood sugar, you'll usually see numbers like 90, 120, 180, or even higher. These numbers are measured in milligrams per deciliter, or mg/dl. So what do these numbers actually mean? A normal fasting blood sugar level, when you haven't eaten for at least 8 hours, is usually between 70 and 99. This means your body is managing sugar well. If your fasting level is between 100 and 125, it may be a warning sign. This condition is often called pre-diabetes, meaning your blood sugar is higher than normal but not high enough to be diabetes yet. A fasting blood sugar level of 126 or higher on multiple tests may indicate diabetes. This is when your body is no longer able to control sugar levels effectively. Now let's talk about blood sugar after eating. About 1 to 2 hours after a meal, your blood sugar naturally rises. In a healthy person, it usually stays below 140, but if it goes above 180, it may be a sign of poor sugar control. You might also hear about random blood sugar readings. These are taken at any time of the day. A reading of 200 or higher can be a serious warning and should not be ignored. The key thing to remember is that it's not just one number that matters. Patterns over time are more important. Frequent high readings can lead to serious health problems if not managed properly. Understanding these numbers helps you make better decisions about your diet, lifestyle, and medical care. In conclusion, blood sugar readings are your body's way of communicating with you. The more you understand them, the better you can take control of your health and prevent future complications. Understanding your blood sugar levels at different times of the day is essential for maintaining good health, especially fasting sugar in the morning and blood sugar after meals. Let's start with fasting blood sugar. Fasting blood sugar is measured after you haven't eaten for at least 8 hours, usually first thing in the morning. This number shows how well your body manages sugar without the influence of recent food. A normal fasting blood sugar level is between 70 and 99 mg/dl. This means your body is controlling glucose effectively overnight. If your fasting level falls between 100 and 125 mg/dl, it may indicate prediabetes. This is a warning sign that your blood sugar is higher than normal and needs attention. A fasting level of 126 mg/dl or higher, especially on more than one test, is often a sign of diabetes and should be taken seriously. Now let's talk about blood sugar after meals. After you eat, your blood sugar naturally rises as your body breaks down food into glucose. This is completely normal. However, the level it reaches and how quickly it comes back down matters a lot. In a healthy person, blood sugar should stay below 140 mg/dl about 1 to 2 hours after a meal. This shows that the body is responding well to insulin. If your post-meal blood sugar rises above 180 mg/dl, it may indicate poor sugar control. Frequent spikes at this level can increase the risk of long-term health problems. The difference between fasting and after-meal sugar is important. Fasting sugar shows your baseline control, while post-meal sugar shows how your body reacts to food. Both numbers together give a complete picture of your blood sugar health. Doctors often recommend monitoring both regularly, especially for people over 40 or those at risk of diabetes. In conclusion, knowing your fasting and post-meal blood sugar ranges helps you stay aware and take action early. With the right habits, you can keep your sugar levels stable and protect your long-term health. Many people believe that if they feel fine, their blood sugar must also be normal. But this is one of the most dangerous myths when it comes to health. The truth is, your blood sugar can be high, even dangerously high, without showing clear symptoms. This is where random blood sugar comes in. Random blood sugar is measured at any time of the day, regardless of when you last ate. It gives a quick snapshot of your current sugar level. While it may seem less important than fasting or post-meal readings, it can actually reveal hidden problems. A normal random blood sugar level is usually below 140 mg/dl. If your reading is consistently above 200 mg/dl, it is considered a serious warning sign and may indicate diabetes. The problem is, many people ignore these numbers because they don't feel sick. Let's talk about the warning signs your body may be giving you. Even if they seem mild, they should not be ignored. Frequent thirst is one of the earliest signs. You may feel like drinking water again and again without feeling satisfied. Frequent urination is another clue. High blood sugar forces your body to remove excess glucose through urine, making you go to the bathroom more often. You might also experience unusual fatigue. Even after resting, you feel tired because your body is not properly using sugar for energy. Blurred vision is another warning sign. High sugar levels can affect the small blood vessels in your eyes, and sometimes there are no symptoms at all. That's the most dangerous situation, when everything feels normal, but your body is under stress. This is why the "I feel fine" mindset can be misleading. Feeling okay does not always mean you are healthy. Doctors strongly recommend regular testing, especially if you are over 40 or have a family history of diabetes. Early detection can prevent serious complications. In conclusion, random blood sugar readings are not something to ignore. They are early warning signals that can help you take action before it's too late. Because when it comes to your health, what you don't feel can still harm you. A blood sugar level above 250 mg/dl is not just high. It's a serious warning sign that your body is in danger. At this level, your system is struggling to manage glucose, and the effects can quickly become life-threatening if not controlled. So, what actually happens inside your body when sugar crosses 250? First, your blood becomes overloaded with glucose. Normally, insulin helps move sugar into your cells for energy. But when levels are this high, your body either doesn't produce enough insulin or cannot use it effectively. As a result, sugar starts building up in your bloodstream. To deal with this, your body tries to remove excess sugar through urine. This leads to frequent urination and dehydration. You may feel extremely thirsty, no matter how much water you drink. At the same time, your cells are not getting the energy they need. Even though there is plenty of sugar in your blood, it cannot enter the cells properly. This can leave you feeling weak, tired, and dizzy. As the situation worsens, your body may begin breaking down fat for energy. This process produces acids called ketones. When ketones build up, they can make your blood acidic, a dangerous condition known as diabetic ketoacidosis, DKA. Symptoms at this stage can include nausea, vomiting, stomach pain, confusion, and even difficulty breathing. If not treated quickly, it can lead to unconsciousness or a medical emergency. High blood sugar also puts stress on your organs. Your heart works harder, your kidneys struggle to filter excess sugar, and your blood vessels begin to suffer damage. The most dangerous part is that many people ignore early warning signs. They may think it's temporary or not serious, allowing the condition to get worse over time. Doctors strongly advise immediate action if blood sugar rises above 250. Drinking water, checking levels regularly, and seeking medical help when needed can prevent serious complications. In conclusion, a blood sugar level above 250 is not something to ignore. It's a critical signal from your body. Taking it seriously can protect your life and prevent long-term damage. High blood sugar is not just a number. It's a serious threat that can lead to life-threatening complications if ignored. Many people delay action because they feel fine, but the damage often happens silently inside the body. One of the most dangerous risks of extremely high blood sugar is diabetic coma. When sugar levels rise too high or drop too low, the brain may not get the energy it needs to function properly. This can lead to confusion, unconsciousness, and in severe cases, coma. Without immediate medical attention, it can be fatal. But coma is not the only danger. Long-term high blood sugar can slowly damage your vital organs. Your heart is at risk, increasing the chances of heart disease and stroke. Your kidneys, which filter waste from your blood, can become overworked and eventually fail. This condition, known as kidney disease, may require lifelong treatment such as dialysis. Your eyes are also vulnerable. High sugar levels can damage the tiny blood vessels in your eyes, leading to vision problems or even blindness over time. Nerve damage is another serious complication. It can cause numbness, tingling, or pain, especially in the hands and feet. In severe cases, it may lead to infections that are difficult to heal. The most alarming part is that many of these complications develop without clear warning signs. You may not notice anything until the damage is already advanced. This is why daily blood sugar monitoring is so important. Checking your sugar regularly helps you understand how your body reacts to food, stress, and daily activities. It allows you to catch dangerous levels early and take action before serious harm occurs. Even a simple habit like checking your sugar in the morning or after meals can make a big difference in managing your health. Doctors strongly recommend that people over 40 or anyone at risk make blood sugar testing a part of their daily routine. In conclusion, ignoring high blood sugar can lead to severe and life-threatening complications. But with awareness and regular monitoring, you can take control and protect your health. Because when it comes to your life, prevention is always better than cure.